Good afternoon, everyone. It is 2:30. Welcome to Cook County Health Department Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a public health educator with Cook County Health Department, and I am your host and moderator for these weekly meetings. Let's get started. There's lots of information to share. As usual, we want to share our meeting objectives, which are to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions, and provide CCDPH contact information and resources. A few announcements. Our webinars are recorded and they are uploaded to our website as well as our CCDPH YouTube page. All of the fall webinars are uploaded, so please check that out if you need to reference back previous webinars. Little housekeeping, we begin promptly at 2:30. Please keep your lines muted and the chat will be disabled during our presentation, and Palak will let me know when to release that chat so we can do Q&A. Contact information for CCDPH, our CCDPH general email, and you can email webinar related questions before Thursday close of business, any general questions you have. Then if you need to report line lists, report communicable diseases, metrics questions, you can email our CCDPH communicable disease reporting email, and as well as access to our website, the school related website. If you want any tools or communications information that you can share and print in your facility, you can find them at our vaccine communication tools website. Please send all EpiPen requests to me, kjones1 at cookcountyhhs.org, and our doctor will sign an EpiPen standing order and prescription, and the facility must be responsible for filling that prescription. All requests must come from a medical professional or have been trained on the administration of medication and certified in administering that medication. All requests must be typed, please. CCDPH is now able to provide bulk PPE to organizations within its jurisdiction. You'll get the link within the slides when I send everything out later on. But organizations within our jurisdiction, meaning not City of Chicago, Skokie, Oak Park, Evanston, or Stickney, are able to request PPE. Those include long-term care facilities, EMS providers, homeless shelters, schools, community-based organizations, and other organizations can request the following: masks, gloves, gowns, face shields, goggles, hand sanitizers, sanitizing wipes, thermometers, and sharps containers. Not everything may be available when you request, and we may not be able to fill the amount that you ask, but we'll do our best. So please look into that resource if you need it. Cook County Health Department is trying to deploy a hyperlocal strategy as opposed to those large vaccination sites we used to have. We are trying to do smaller sites within our community to have a greater reach, especially providing more resources and support to the following communities that have the lowest vaccination rate, and we want to implore a lot of support to these communities. Would your school like to have Cook County Health Department at their event providing CCDPH's vaccination? You can request it with the following link as well. The link will be provided when I send out all the slides. And here's information on upcoming event that's going on right now. It started on Friday. We are at Chicago Ridge Mall for a vaccination event, and we're there until today until 6, and then ending tomorrow 10 to 6. Next week, we are at Sauk Village Shopping Center from October 12th to the 16th from 10 a.m. to 6 p.m. Here is a list of some other Cook County partnered vaccination events that are in the community. You can check those out when I send out these slides. As well as, I think there's one more date coming up for the vaccine event in Hazel Crest. And if you participate, you get free zipline tickets. Good luck with that. There is a farmers market and resource fair in Harvey. The next date is October 7th. They had another date yesterday. There are numerous calendars of events in the community on our CCDPH public health calendar. Please check that out for upcoming events. There are lots of things coming down the pike. We are pretty busy. I just received this resource earlier this week. I thought it'd be great for schools to check it out. There's an upcoming webinar from the EPA on indoor air quality tools for schools. It's about ventilation and COVID-19 in schools. So it talks about how to assess and prioritize and plan your HVAC systems and ventilations within schools. I'll forward that email with the link with all the slides that I send out after the webinar. Does your school have an existing COVID-19 testing program? We'd love to hear about it. Please fill out the following link if you prefer. If you are interested in participating in the Binax rapid antigen testing, you can click the following link and fill out the waiver form if you have not already done so and request those Binax tests. If you are interested in setting up Shield testing through IDPH, you can do that and by emailing the DPH antigen testing email address listed. If you would like to have a speaker come to your organization to speak on COVID-related subjects, you can fill out the Google Doc. I'm sorry, there's a loud car passing by my window. You can fill out the Google Doc and a speaker will be assigned to your event. If you know someone who is interested in getting the vaccine, but they do not have transportation, they can call the 833 number and a ride can pick them up, wait for them to finish their vaccine appointment, and then drop them off back home. You can also call the same number if you like the vaccine, but you are homebound. This is for suburban Cook County, not counting the city of Chicago and those other private health departments, which is Skokie, Evanston, Oak Park, and Stickney. And here's some more resource information that we have. And I'm going to stop sharing and toss it over to Palak. I was about to say Lex. I'm so used to saying Lex. And then she will be your presenter today. Hey, Palak.
All right. Hi, everyone. I apologize. It took me a bit of time. To those who don't know me, my name is Palak Panchal. I am the program manager for vaccine preventable disease here at Cook County Department of Public Health. And I am filling in for Lex today, but she will be answering your questions in the chat. So we have a lot of updates. Today, there is a bit of a pleasant surprise for all the school nurses. So, please hold your questions. I will go through all the slides and most likely I will answer all of your questions and then we can begin the chat. So on the agenda today, we are going to talk a bit about housekeeping, which includes all our school health information, some metrics update for suburban Cook County and IDPH, travel guidance, the surprise I was telling you about return to school work, the questions that were submitted to us in the last week. And at the end, there are just some reference slides, which I will skim over them because these slides will be sent out. So let's begin. I just want to remind you that our hours, CCDPH hours, are Monday through Friday, 8:30 a.m. to 4:30 p.m. We are closed on federal holidays. This Monday is Columbus Day. We are closed, so we will, after 4:30 today, we will answer all your calls and emails on Tuesday. Our website, cookcountypublichealth.org/school-health, has all the information about reporting, testing, vaccine information, and the guidances, which I'll show you in the next slide. We have our own email, ccdph_schools@cookcountyhhs.org. Please use this email to report cases, close contacts associated with school, outbreaks. It's good to write in the email subject, the subject line of the email, urgent outbreak, so we know to give it the highest priority. Guidance questions, and if you want us to call you back, this will be the best. The reason email is the best way to reach us is because it is managed by several of us. We are intermittently in and out of office, so calling tends to overwhelm our lines, and one of us is always looking through those emails to answer you. We just to those who's it's the first time attending our webinars, we have it every Friday, 2:30 p.m. to 3:30 p.m. on our school health website. We have the link for registration and the YouTube link that I'm posting on this slide, so you can watch all the past webinars as well. And I wanted to point out the graphic on the right, where whenever you send us an email, the highest priority will be given to emails about outbreaks. and then the guidance in terms of reporting, quarantine, testing, and vaccine. And the lowest priority will be given to hypothetical scenarios if we have just because we are short on time, and we want to be able to help those who are actually going through the real world scenario. And then we can always respond to you for the hypothetical one. I do want to remind that please do not give us our personal information to parents. We've had some parents call either Lex or Michelle on their personal phone numbers. Don't know how they got it, but it's those are personal. There's work cell numbers and there's personal cell numbers. So please do not give our personal information. Always refer them to either CCDPH schools or the COVID-19 general email to the parents. That would be the best. This I want to show you. The slides shows our school health website. We have COVID vaccine information, reporting instructions, our spreadsheet, testing, reporting point of care, test results, guidance. And when you scroll all the way down, you will see the webinars posted on the page. So what has changed since last Friday? IDPH changed the outbreak definition to 3 cases. And this will begin from last Friday. Outbreak with the first onset date on or after October 1st, 2021. The outbreak, how the outbreak is defined by IDPH is it will comprise multiple cases of at least 10% of students, teachers, staff within a core group, or at least 3 cases within a core group. And they must meet criteria for probable or confirmed school-associated case with a symptom onset or positive test result within 14 days of each other. And they should not be identified as close contacts of each other in another setting, such as household or outside of school, for example, playground or private party. And these cases must be epidemiologically linked in a school setting or school sanctioned extracurricular activities. So what's a core group? Core group includes but is not limited to extracurricular activity or a cohort group or classroom before or after school care. A school sanctioned extracurricular activity, IDPH defined it as a voluntary activity sponsored by school or local education agency, and they may include public performances, contests, athletic competitions. For onset, we ask that you use the symptom onset date when it comes to outbreaks. And if it is unknown or a case is asymptomatic, then please use specimen collection date for the first specimen that tested positive. So for example, a person who tested positive via rapid and then confirmatory test. So use the first test that was used that showed the positive test result. Before contacting CCDPH so that we reduce the number of back and forth emails or calls, it's best to gather this information before calling us. That way everything is streamlined on your end and our end, and we are not wasting each other's time. Please interview 3 or more cases and ask about their symptoms, the date of test, rapid, antigen, point of care, shield, rapid PCR, whichever tests were taken, dates of exposure, and ask about the location of exposure as well, like whether it occurred in indoor classroom or in extracurricular activity, whether it was an external social gathering, such as a private event, party, mingling in-house, then it's not considered. If it's external to school, then we know that it didn't have to deal with school, and then we don't even have to worry about it. We can give it to our other epidemiologist who deals with the community outbreaks. This slide shows the metrics for this week. The top graph is the report week for youth cases under 20 years in suburban Cook County. And as you can see that late September, the graph peaked, or the number of cases reported peaked and then dipped a little in October, early October, and we are starting to see a slight increase. And the bottom graph is from IDPH, and it's categorized by all age groups. And again, this matches our suburban Cook County. As you can see, there is a very tiny increase, but we will see, I think only time will tell whether this is a real increase or if it will dip down again. So prevention and control strategies are so important so that as we go into the holiday season, we don't again see the spike that we saw last November through January. This slide shows the suburban Cook County metrics. So as of October 7th, as of yesterday, we've had over 282,000 confirmed cases, over 4,700 deaths, and our community transmission still remains high. So we continue to have to be vigilant about masking, social distancing, to make sure that we can hopefully not repeat the same last winter season. Currently, Illinois has about 236 active school outbreaks, and in Cook County comprises of 31 of those. This is the travel guidance page. I got this slide from the Chicago's travel advisory, which is what we are using. The map shows, except for California and Connecticut, all the states are in orange. So still high everywhere. Please we recommend you do not travel if you're unvaccinated. And if you do have to travel for any reason, please, for vaccinated travelers, they must monitor health for 14, must as in we highly recommend that you monitor health for 14 days after you arrive back to suburban Cook County. Testing and short quarantine is highly recommended but not required. For an unvaccinated adult, after an unvaccinated adult travels, we highly recommend that they test 3 to 5 days after arriving and stay home and self-quarantine for full 7 days after travel, if possible. Even if a person tests negative, we again highly recommend to stay home and self-quarantine for full 7 days. If an unvaccinated adult decides not to test, then we recommend 10 days of quarantine. Or if that is not possible, I would just say minimize as much social contact as possible, keep distance, meet people outside with masks on, because I do understand it is difficult in this for a person to be able to quarantine for those full days, but we recommend that people continue to be vigilant. For unvaccinated students, they can return when the students travel back to Cook County after travel, they can return to school the next day, but they must get tested. They should get tested 3 to 5 days after travel and self-monitor for symptoms for full 14 days. This is described in great detail in the FAQs posted on ISB under question number 80. For international travel, these are the requirements. Prior to travel to US, they must have a negative test result, including those who have been vaccinated. And after travel, it's recommended they test 3 to 5 days and self-monitor for symptoms. So it's the same deal for everybody, vaccinated or unvaccinated. Highly recommend test 3 to 5 days and continue to self-monitor for symptoms. For return to school, I hope this will help all the school nurses and us to make things easier. We are accepting PCR tests for return to school for students and staff. We've always been accepting negative test results of lab-based PCR tests. We continue to highly recommend these, but we made a decision to also accept negative point of care or rapid PCR test, and this should be, I would say, apply with caution. With kids who have had no known close contact with a case. And again, this decision has been made internally, not because of the metrics or what's happening in the community. We do understand the challenges schools are facing and challenges that parents are facing in terms of these tests by North Shore and other clinics who are only providing rapid PCR tests. It does get confusing. So please know that we heard you, we listened. We want to make sure that kids continue to be able to come to school and the stress level goes low for all of us. However, we highly recommend for return to school lab-based PCR test. If you can ask for students, if students are able to get those, then great. So please continue to stress that lab-based PCR tests are highly recommended. What we are not accepting are negative rapid antigen tests. or alternate diagnosis due to existing conditions such as allergies or migraines, or doctor's notes that includes also alternate diagnosis. I wanted to put this slide that I got from IDPH this past Tuesday's webinar, Shield for Shield testing. It is a NAT lab-based PCR. It has a remarkable sensitivity and specificity, and it does not require confirmation. I do know that a lot of students, parents take them for confirmatory testing. It is not recommended. It does not require it just because it's a wonderful test. And also, if a person does test positive via Shield, it does not, subsequent negative tests won't invalidate a previous positive test result by Shield. So please continue to advise parents, or if you have, if you can send out a blast email, continue to recommend to parents that confirmatory testing is not needed. And I don't think the students need to be subjected to so many of these tests, considering we are in high transmission right now. So the next two slides, I'm going to go over the submitted questions that were sent to us, or questions that were submitted to us in the last week. Can we accept a positive at-home test for a symptomatic individual as a probable positive and proceed with isolation, contact tracing, and reporting? Yes, it is considered a probable case. Right away, please go ahead and do contact tracing, and then, of course, contact us. How long are negative Shield tests valid? Per IDPH's guidance, the negative Shield tests are valid from 48 hours from the date of test, not the date of test results. Is SARS-CoV-2 NAT different from RT-PCR? So NAT tests are nucleic acid amplification tests. It's a broad category that describes the tests that amplify or increase the number of RNA in the SARS-CoV-2. And RT-PCRs are a type of NAT test. And other tests also fall under the NAT category, and I have given the link. So when we send the slides out, you can check whenever you receive these test results from staff or from students. The next question. We were informed on Tuesday by IDPH during their webinar that if a student has COVID-like symptoms, they must be RT-PCR tested within 48 hours. They refer within 24 hours. And if not, they must be quarantined for 10 days, regardless if they receive a negative RT-PCR after 48 hours. This is correct. RT-PCR should occur within 48 hours of when the students are sent home or are staying home or stayed home for COVID-like symptoms. The results do not need to be returned within 48 hours, just that the tests need to be performed. And otherwise, they should stay home for 10 days while they rest and get better. Next question. Does epidemiologically linked mean they have to be in the same classroom within 14 days, even if they were not considered close contacts? Or does it mean 2 or more positives in the same class over 14 days that were close contacts? And CDC defines epidemiologically linked case as a case in which a patient or a case has had contact with one or more person who have had COVID, and they were the transmission happened, like respiratory transmission, close contact. And a case can be considered epidemiologically linked to a laboratory confirmed case if at least one case in the chain of transmission is laboratory confirmed. So for example, there are 2 students, one student is lab confirmed and another student develops symptoms after the close contact, they would be considered epidemiologically linked. Next question. Can you please clarify whether unvaccinated school employees can submit the results of a home COVID test, such as Binex Now for weekly compliance testing? This answer is provided in the ISB and question 32. For schools and school districts, at home or self-tests that are fully self-administered are permissible. However, only when the school or school district requires a proof through a video or picture of the test results to be available upon request. And there are limitations to these tests in terms of how they are collected. And so, if the schools do choose to allow these staff to use at-home tests, please note of these limitations. Next question. Is it necessary to wait until confirmatory PCR results in order to contact, quarantine, test to stay those individuals identified as close contacts? No. If any test comes back positive, contact tracing, we highly recommend it should start immediately. And if a close contact develops COVID-like symptoms, the close contact is considered now a probable case, and you can begin contact tracing as well as soon as the symptoms begin. Next question. If someone is determined to be a close contact at school, less than 3 feet for 15 minutes or more, and they're both adequately masked, can we do test to stay even if the contact is not enrolled in SHIELD? IDPH highly recommends that that a student must be enrolled in the SHIELD testing program, or it could be any other weekly testing program in order for test to stay to be implemented. If, let's say, parental consent was not given, then you may CCDPH will recommend 14 days of quarantine, but a school, if they are able to meet the criteria for shortened quarantine, you may implement those if the student hasn't received the parental consent for SHIELD. Next question. Are school districts responsible for notifying daycare facilities about positive COVID cases? The school districts are only responsible for notifying daycare facilities if the daycare facility is part of the school district. However, families are expected to notify their daycare facility, and or a contact tracer will gather that information and will pass it on. So we highly recommend that you encourage the families to notify schools and daycares that are not in the same district if there is a case in the family. So next few slides are going to be reference slides. However, I do want to point this slide out because we tend to use the word quarantine interchangeably, but there's a stark difference between the words quarantine and isolation. Cases isolate. Isolation, what it means that it separates sick people who have the disease, so people who have COVID, from people who are not sick. And a negative test can never test a person out of isolation. We are never going to release people from isolation if they've been confirmed cases. They must finish 10 days of isolation. And for close contacts, the quarantine word is used. Quarantine means it separates and restricts the movement of people who were exposed to COVID to see if they become sick. So the incubation period of COVID is 2 to 14 days. And that's why when people are asked to quarantine for 14 days, it is during that time that a person may develop symptoms. And there have been cases where we have been notified that a person remained asymptomatic until day 13, and on day 14 they became sick with COVID-like symptoms. They lost their sense of taste or smell. Again, we will continue to recommend 14 days. There are shortened quarantines. There is test to stay, which if there's a testing program, you may implement test to stay for those people who are enrolled in the weekly testing program. This slide discusses symptomatic household member. The next slide is what quarantine options that school can choose. In the interest of time, I'm not going to go over these. When the slides are sent out, you can go ahead and please go through these in detail. I do want to provide clarifications from last Friday's webinar. Test to stay option is available to both students and staff. And negative COVID diagnostic test results are good for the next 48 hours. Please see the column B under the exclusion decision tree. And I also wanted to point out, if someone does receive a negative SHIELD test one day, so let's say today, and then develops COVID-like symptoms the next day, and they have not had any known close contact, the negative test results covers them through 48 hours, and they do not need to be excluded. However, if there are symptoms, please, it's always best for people not to come to school if, it's symptomatic. So that's always been the case even before pandemic. It continues to be the case even during pandemic. And the negative test results is good for the next full school day and the day of the test. So for example, if today someone tested negative during lunch, it will go. It should the test result should cover them for next 48 hours. And I would like to, Kelly, you can open up the chat if you can so people can start posting questions. I still want to remind you, please use our CCDPH school email for any communication pertaining to school. A lot of the emails are sent to our COVID-19 email, which is a general email, but they get forwarded to this. So they will always be routed back to schools. Please, but they don't always come immediately. So we ask that you continue to email school-related questions to the ccdph_schools email. Please try to consolidate all the case reports and questions to one email, because the more separate emails we receive, the more delay there will be on our end, because as we try to answer your emails. Again, please do not forward our personal numbers or emails to parents who love to challenge about quarantine. We will always discuss with the school nurses, so then we will ask the school nurses to relate back to parents. If you receive a release letter, please double check the release letter date with the return dates in your spreadsheet. Do let the parents know to expect calls from us, because a lot of the times the parents are screening our calls and they think that we haven't contacted them. We have a wonderful school team that is working very hard to be very responsive. And again, I need to remind you, Test to Stay is only allowed if a student is enrolled in a weekly screening program. And thank you so much. And I will try to answer let me see if Michelle have been answering questions. Oh, Carrie, what was a happy surprise for our nurses? It is one that we are accepting the rapid point of care PCR test for return if a student is symptomatic and has had no known close contact. And we are hoping that this would cut down a lot of the stress that we all have been facing. Is a 7-day return with test and no symptoms available to students? No, 7-day shortened quarantine is only a person has to be asymptomatic and they must get tested on the 6th day and then they can return. If they have a negative test, they can return on 8th day. Because we are in high transmission, are we to quarantine symptomatic students for 14 days and not 10 days? Are we talking about the let's see if this has been answered. Oh, Lex has already answered. Symptomatic students who do not have any known close contact need to quarantine for 10 days if they do not get a test within 48 hours. And they have to remain asymptomatic in order to come back and continue to monitor their symptoms. If unvaccinated staff are testing weekly on their own, can we use Binex Now for Test to Stay for staff? Or do the staff members have to participate in a weekly test provided by the school district in order to participate in Test to Stay? Let me see if it has been answered. No. If unvaccinated staff are testing weekly on their own, can we use Binex Now for Test to Stay for staff, or do the staff members have to participate? You can use Binex Now if you don't have the Shield program. And Lex, Michelle, if you want to add anything to that, please go ahead.
Yeah, Andrea, so the Abbott ID now is a rapid net test. It's definitely not one of our preferred tests to use. However, we cannot single out a single test to say that we definitely would not use one test over the other, which is why we would be accepting the Abbott ID now to return students.
Okay, what's the next? The next question is, thank you, Michelle. The next question by Haley, if a student gets tested after 48 hours of, symptom onset, can we accept for return to school, or do they have to be home for 10 days? And if the test result is negative, I'm assuming. Student gets tested after 48 hours of symptom onset. Can we accept for it, or do they have to be? They must get tested after 48. I think if it's positive, yes, they must stay home for 10 days. I'm sorry, I don't understand this question. Okay, let's answer. For domestic travel, the CCDPH slide refers to FAQ number 80. What about international travel? Can unvaccinated students also come back to school while awaiting testing? For international travel, we defer to CDC. There are requirements for coming back for negative tests. So we recommend that you use CDC's guidance for international travel. Looks like there are no other questions. Oh, there's one more. The CDC guidance states that unvaccinated individuals who travel internationally should get tested with a viral test 3 to 5 days after travel and stay home and self-quarantine for full 7 days after travel. Does this mean we should exclude them from school for this period? Lex answered yes for international travel. I think this is it. Kelly, you can take over now. Please, if you have any questions, please email us. We are here. We are here today until 4:30. Please remember, Monday, we are not open. We are not checking our emails during the weekend. We will be enjoying the 3-day weekend. So we'll talk to you on Tuesday.
Real quick, this is Lex, by the way. Sorry, Pollock's giving the presentation because I've lost my voice from my allergies. I have a quick announcement that came out, and I'm gonna pop it in the chat for everybody. IDPH announced a new partnership that's going to help expand testing in schools. It's the Midwest COVID-19 Testing Coordination Center. And basically, they're going to help with onboarding and help everybody get set up and help provide like a self-collection protocol and help people ship samples that Shield will reimburse so that people can get the ball rolling as we head into fall and winter. The full announcement is in the chat if you want to check that out. So for people who have been kind of struggling with the onboarding process just because there have been so many requests, there's going to be added help now and added funding to accommodate that.
Thanks, Lex. We appreciate all the resources. Thanks, Palak. You did a fantastic job. And thank you, everyone, for taking time out of your Friday. I know a lot of schools are out today, but you still made it. Enjoy the 3-day weekend. I know I will. And it's supposed to be summer-like temperatures. We can't get fall yet for nothing. I'm waiting for some cold weather. So enjoy and be careful. Stay well. We will see you next week. Thank you.